For our second episode, we're exploring the Virginia Department of Health's Office of Licensure and Certification, often referred to as OLC. We spoke with leadership as well as the boots on the ground whose stories often go untold, the medical facilities inspectors. We're shining a light on the essential work of these public health detectives and the meaningful impact that they have on Virginia's communities.
The team members at OLC are directly responsible for ensuring that Virginia's hospitals, nursing homes, hospice, and home care organizations are providing the safest care possible for the most vulnerable of Virginians.
Chances are you're an experienced health professional.
Are you an experienced nurse, laboratory technician, radiologist, social worker, or other licensed healthcare provider?
And you've committed years and knowledge and your heart to doing the right thing by patients in a variety of different settings. To go into a nursing facility, a nursing home, a long-term care facility, and utilize your critical thinking and knowledge that you've had from years and maybe even a lifetime of healthcare professional work gives you that chance to use it for those that really need it. To be a medical facility inspector allows you also to grow. It allows you to take all the knowledge, all of the education, your collaboration with your peers, work as a team to evaluate the care that's in a nursing home. So you grow professionally, internally, but you also have the chance to grow within the organization.
I've always known that I wanted to be a nurse. And so I started out as a CNA in a nursing home, and then I worked my way up with becoming an LPN, and then eventually an RN, and now I'm a medical facility inspector.
My role started as an LPN. I went back to school, became an RN, worked in acute care, worked in informatics, worked in quality.
I've been a nurse for 48 years. I started out as a certified nursing assistant. My love for the elderly grew from that. I've had many nursing experiences throughout my career, and I came back to long-term care. In this job, we go into many of the nursing homes year after year, and you get to know the residents. And sometimes it's just fun to go in and seek the resident, or the resident seeks you out and share a personal moment with them to see how they've been doing.
There was a resident that I had interviewed, and he mentioned that he had been admitted to the facility and had been there for a few months and had not been able to get into the shower room to have a shower due to the facility not having the proper equipment. And through the survey process, I was able to get the resident a proper shower bench. And by the end of the survey, he came to me and specifically thanked me. And that just really warmed my heart.
During COVID, I was coming in to do a facility inspection, and a resident family member came up to me and said, "Are you going to be going in the building? Are they letting you in?" I said, "Yes, I work for the health department." She said, "I thought so. I really need you to tell my mom I'm here. She's in that room," and she pointed the room out. And then I did stop at the room and let the woman know that her daughter was outside. It made me feel good too.
All of us expect and deserve the safe provision of healthcare. From the coast to the mountains, we expect it to be delivered appropriately and safely.
Being a medical facilities inspector is rewarding in the fact that we know we are making a difference in these residents' lives.
Working for the OLC, you are part of a team.
It's challenging, collaborative, and rewarding. There is support in the office whenever you need it.
And there is no better feeling than working with others who have the patient and their family at the center.
From the first few days of life of a premature patient being cared for in a neonatal intensive care unit, to the last few days of life of a patient being cared for in a nursing home.
It's a privilege to have the chance to be involved with some of our most vulnerable Virginians, those that have entrusted their care to us.
And I can't think of a more important mission than that.